Okay, good morning all. In the theory sessions, today we will be learning Shotha as our next disease. Again, since we are doing it after some break, in theory, of course, we did the practical. If there is any query, as we have been doing, you can break me in. You can ask the question, and then we can move along with the lecture there. So the disease which we are going to learn today is called as Shotha in Sanskrit. Shotha. Okay, and so let us start with the introduction and definition. So the disease in which there is swelling or edema in a body part or the whole body is called as Shotha. So in the definition itself, you can understand that there is swelling or edema. It can be compared with the swelling or edema, which is seen in the modern science as well. So it can happen to a body part or the whole body. Okay, we all know that. We've seen Shotha in various diseases previously. Of course, you may not be able to recall them now, but as we move along, you may recall. So it is basically swelling or edema to a body part or the whole body. So when it's wherever the localized body part or wherever the location of the swelling is, accordingly it is named likewise. So you have Sandhi Shodha, Shotha to the joint, Sandhi Shotha, or Shotha to the Arsha, okay, swelling to the or edema to the arsha or swelling to the back or the head or the chest, so accordingly, or to a finger or to the whole body. The whole body shotha is called as anasarka. Anasarka in the modern terminology. If you can remember anasarka, we saw this in which disease? I'll keep asking questions now since I know you all. I can keep asking you questions and I'll ensure that you all are awake. It is a nice, good morning. I'm sure it must be sunny at your places. So, where did we see Anasarka? In which disease? Were you able to recall? Anybody? Anasarka. There can be Anasarka in the whole body or swelling in the whole body. Where did we see? Pandu.
Undo. Okay. I was going to say
Yeah.
but no, it's not really spelling.
So, yeah, I mean, it is Shotha to the whole body. However, it is quite mild. So it is not really seen as swelling or edema as such. But when we learn it from the Ayurveda perspective, there is Shotha. Akshikuta Shotha also is there, swelling below the eyes. And there can be Anasarka. Shotha to the whole body. Okay, Nicole? Fair. So there is puffiness or raised surface which changes the natural shape and size of the body part or the body. So there is a natural shape to every body part, we know. And when there is change in that natural shape, so you see swollen finger or swollen joint, this is where usually the swelling is. Or there is when there is trauma to a body part like a muscle, then there can be swelling in the muscle as well. Uh, there is puffiness or raised surface which changes the natural shape. So there is suppose swelling in the wrist joint or in the palm. back of the palm. And you can see um, puffiness or raised surface. So it can be one-sided, it can be to the whole hand as well. So when there is trauma, all the fingers, front, back, all will change the shape. So puffiness can be seen, or a raised or elevated surface also can be seen to that body part or to the whole body. So it appears as if something is getting accumulated in that area. Naturally, when the shape changes, when there is swelling, suppose it's a balloon, okay, and it is deflated, so it has uh, no shape as such. And when we blow air into that, then it will take some shape and it will swell up. And naturally, as it grows in size, there is something inside which is occupying that space. Okay, it can be air, it can be water, it can be blood, it can be pus. Now, I'm again coming back to Shotha, not to the balloon, but when there is something which uh, inflates, naturally there will be something which will occupy the space inside. So it appears as if something is getting accumulated in that area where the Shotha is, where the edema is. So in our case, in this disease, it can be interstitial fluid, it can be blood, it can be pus, um, it can be a dead tissue also, as it uh, can also occupy space when there is death in that tissue. So the tissue dies. Of course, as the tissue dies and it is some time has passed in between, then it will shrink. That is the next step. Okay, because the blood supply to that area will reduce. Hence, the process of dying will start. So when there is decay, also there can be swelling. Anyway, so it appears as if something is getting accumulated in that area. Hence, the swelling is seen. Shotha is a disease of the Bahya Marga, external route. We've seen the disease marga, the Vyadhi marga, Abhyantar, Bahya, and Madhyama. Okay, which the margas you have studied before, of course, but we did mention this during few of the diseases. So Shotha is disease of the Bahya Marga, the external route. Shotha is seen as a sign in many diseases. So in that case, it becomes a secondary sign and is also seen as a primary disease, which we are going to study now. So we know what is the difference between a secondary sign and the primary disease. So when there is secondary sign or symptom, we treat the primary disease, and the symptom or sign which has appeared will subside on its own. And usually when it doesn't, it is a secondary disease. Sorry, it is a primary disease. Correct. So in that case, we will have to treat the primary cause, the primary disease. Okay. So sometimes it happens that uh, you have, suppose, anasarca. You see a patient of anasarca, swelling all over the body or majorly the body parts. So it's not localized, it is uh, to different parts of the body. So uh, you are not able to diagnose what it is, and you keep treating the body or the patient with Shotha treatment, as we are learning today. But the Shotha doesn't reduce because the primary cause is Pandu, for example, or it may be some other disease. So when you are not able to diagnose, so what if the diagnosis goes wrong or you are not able to reach the diagnosis? It can happen initially. Of course, it can happen in complicated cases also where there is presence of multiple things at a time and it has turned into a chronic group of sign symptoms or diseases together. So there is a presence of two or three diseases together. In that case also this confusion can happen that we try to diagnose it with a particular disease and try to treat it accordingly, but actually that is a secondary sign or symptom of a primary disease which is not diagnosed yet. So you see a patient of Shotha and or you see edema on the body and you try to uh, treat it uh, as per your understanding of Pandu. Sorry, as per your understanding of Shotha. And you keep treating, and after 15 days or 1 month of treatment, you see that there is no considerable reduction in the Shotha. So in that case, you may have to go back again to your consultation and see if you can relate it to some other primary disease. So when it is a primary disease, Shotha, you do treatment of Shotha and it will reduce. When it is a secondary, it has come as a secondary sign or symptom of some other disease which you have not yet diagnosed, it will not reduce. So this will happen with any other uh, disease which comes as a secondary sign or symptom to some other primary disease. You're getting my point? So Shotha is there, or Shwasa is there, or Kasa is there, or uh, what Hikka is there, which we are going to learn today. So when you try to uh, treat it as a primary disease, the symptom, sign and symptoms will not reduce when the diagnosis is different than what it ideally should be. And there is absolutely nothing wrong in this because you have not done anything uh, on purpose to the patient. You are not doing anything wrong to the patient, right? So uh, whatever treatment which you are giving, maybe of the primary disease or of the secondary disease, majorly in the secondary sign symptom, that is not going to cause any harm to the patient or to the primary disease also. Okay, so Shotha is seen as a sign in in other primary diseases, and it. Sorry, I'm just putting the device on charge. Is the setting okay, Hilary, or can anybody confirm if the setting is okay?
Setting is perfect. Yep.
Okay, okay, fine. So Shotha is seen as a sign in many diseases uh, as a secondary uh, presence or a symptom and is also seen as a primary disease which we are going to study today. So types of Shotha. Shotha is of 9 types you can see. The first 7 are Nija and the last 2 are Agantuja. So I'm sure because you have studied diseases now, you know what is Nija and what is Agantuja. So Nija is basically which is formed because of the vitiation of doshas or the factors which are inside the body. Okay, so it starts from inside, that is Nija. And Agantu is because of the external factors. Okay, so something which is a causative factor from the external source. Okay, like trauma or a poisonous substance. Okay, so that is agantuja. So vataja shotha, pittaja shotha, kafaja shotha, vata pittaj, pitta kafaj, kapha vataj, and sannipataj according to the doshas. So these are seven types first, and then there is abhighataja, which is because of external trauma, and then vishaja or poisonous because of poison or chemical contact of poison or chemical. Okay, so that is vishaja shodha. So as we learn next step, we will understand what is the sign symptom seen in each of them. So what are the causative factors or etiological factors? Hetu, consumption of or exposure to the below said factors by people who have been debilitated or lost their strength because of undergoing Shuddhi or Panchakarma treatments. So, long sentence, let me explain. So, we know that Panchakarma is a type of cleansing process. So, there are five types, etc. So, that is a Shuddhi process, Shodhana treatment. And when we do Shodhana treatment to the patients, naturally the strength of the patient initially has reduced because of the doshas going out. So in that case, if there is excess of shuddhi or excess doshas then required have gone out, then the patient would have lost strength than more than expected and has got debilitated. There is depletion of uh, the dhatus and the overall strength of the body. In during that phase, if the patient consumes the causative factors or doshas aggravating food and lifestyle, then shota can happen rapidly. So hence consumption of exposure or exposure to the below said factors. So what are the factors? We'll see now. So you have to consider that the patient has undergone panchakarma and has done shuddhi uh, and has is now uh, getting exposed to what in the last part kshara, amla, tikshna, ushna, guru, dadi or mrita, which is mud in excess, which will aggravate the doshas. Okay, so that is one part. Apart from that, patients who are suffering from jwara, jwara is fever, we'll study that later, and pandu or anemia, which it can be correlated to diseases, and they do uh, get exposed to again kshara, amla, tikshna, ushna, guru, dadi, mrita, again, etc. Apart from that, the third thing, people who do fasting, excessive fasting, they also lose their strength. Excessive fasting will aggravate the vata dosha and depletion of dhatus will certainly happen. When it is done in excess, loss of strength will be seen, and in that case, if they consume kshara, excess of kshara, amla, tikshna, ushna, guru, dadi, etc., it will aggravate the dosha and shota can get created. People who consume incompatible foods, which is viruddhana, in excess, okay, or kshara, excess alkalis, amla, tikshna, ushna, guru, dadi, mrita. But so here in this entire point, you see patient who has lost strength due to shuddhi kriya of panchakarma or is suffering from other diseases and has lost strength or has done excessive fasting has lost strength. Okay, so has lost strength of physical strength. The agni has uh, got depleted. The dhatus have got depleted. So dhatu kshaya is seen, and in that phase or in that stage, if the patient is consuming incompatible foods or kshara or amla, tikshna, ushna, gurudadi, mrita, which is mud in excess, will cause the vitiation of doshas, and the samprapti or the pathogenesis of shotha will start. Shaka, green vegetables excess, viruddha ahara, we saw dushta anna. So I am sure amla, tikshna, ushna, guru, dadi, we are clear with what is the meaning of that. Amla is sour, uh, tikshna is corrosive, okay, and uh, ushna is hot, guru is heavy to digest, dadi is yogurt or curd, mrita means mud. Shaka or the green vegetables, shaka means green vegetables. Viruddha ahara, incompatible foods. Dushta anna or contaminated food. Dushita anna is a causative factor in lot of diseases. So for that, I keep saying this. If your mind is connected to what you are doing, okay, especially while consuming food, then your sensory organs will identify that something which you are consuming is not good or not proper, is not in good quality. So dushta anna, contaminated food, you can see the changes in color. Whatever the natural color was after it was cooked, or whatever, if you are eating it fresh, whatever the natural color of that particular food item is, it has changed, okay, which is if you are seeing it while you are eating, then or the patient, when I keep saying you, related to the patient, when the patient is looking at that food and eating it, then they can see or realize. But if the patient is watching a television or mobile phone or reading something else or looking somewhere else, his or her mind is not present or not focusing on the food, then they will not realize the color changes. Okay, the smell of the food. I'm sure you must have done it yourself also, that you, if there is something different, or you see that there is change in color, what is the next thing you do? You try to smell it and see if the smell or the aroma which it naturally has is present, or if it is different now. So in that case, you see different, you smell different. And then the third thing, if these two senses are not able to identify any changes, the taste, your tongue will certainly identify. Now, again, I'm saying if uh, there is the beginning of uh, this, the damage to the food has just recently started, so it is early stage of damage, uh, then you may not see the changes, you may not smell the changes, but you can taste it subtly. Of course, in that case also, the focus on the food has to be there. Okay, so I'm sure people who cook, and we had very good cooking sessions with Sonia, so she can relate to this very quickly, that there is some change in the color or the smell, and finally the taste can uh, give an indication that the food is now getting damaged and should not be consumed. But if there is early stage, and if the patient also is not focusing on what he or she is eating, then dushta anna can get consumed. So shotha can happen, that is one part. But if it is excess of contamination, then Food poisoning also can happen, right? So wherever you see food poisoning cases, dushtan or contaminated food uh, is was consumed. Visha upasrushta anna, poisoned food. Now, when we say Visha upasrushta anna, when a poisonous substance comes in contact with the food, changes in color, changes in smell, changes in taste will be seen. Again, uh, poison can be put, or it can happen due to the type of food items which should not be uh, mixed together, get mixed, or a process to that particular food item is done which ideally should not be done, or the vessel or the metal in which the food is being prepared is not in sync with the properties of the food item, then poisoning can happen. So we see that metal poisoning, uh, we see honey, for example. If you have studied honey, we say that honey should not be heated because it changes its properties and it can become harmful to the body. Let us not call it poisonous, but it can become harmful to the body. Hence, it should not be heated. So it is a process which is done on the food item, which is honey, or honey and ghee, grita, should not be mixed in same proportion. Okay, so the third item which uh, gets formed after these two are mixed becomes harmful to the body. Okay, so this is what we see in the classical textbooks. What will happen if once honey and grit are mixed in same proportion and consumed? It may show harmful effects. It may not show in the first go, but if it is done on a regular basis, then it will certainly show some or the other uh, concern. Okay, so Visha Upasrushta Anna, which is a poisonous food item, if it is consumed, Shotha can happen. Now, uh, when it is poisonous and it should not be consumed, and by mistake, if it is consumed, especially in children who are not aware what a particular thing is, and uh, because of unawareness or lack of knowledge to their age, if they consume the poisonous food, then various other signs and symptoms of the poisoning will be seen, but Shotha also will be seen as one of the signs. Okay, so it can happen with various corrosive chemical liquids or poisonous items which are usually used for some other purpose of uh, fungicidals or pesticides, etc. So those, if by mistake are consumed, can show Shotha. Now, um, as we see the signs and symptoms, we discuss that in detail. But when poisonous food items are consumed, then Shotha can be seen, is what you should remember here. So, in Abhighataj, Shotha, type of Shotha, what are the hetus? External trauma. Okay, external trauma. So, it can be accident or it can be um, a trauma. So, it can be mild, it can be heavy, depending on what is the intensity of the trauma. Shotha will be seen. Various chemicals, corrosive chemicals, we just discussed about it. Insect bites. Insect bites can cause Shotha. So we see. So starting from snake bites, which is pretty common. Then you have animal bites, you have insects or Even small, if you have experienced, I'm sure everybody has mosquito bites, honeybee bites. Okay, so honeybee bites are usually very strong, so they will create uh, a lot of swelling, pain, etc. So that is again different, but insect bites, animal bites will show Shotha. Snake bite. Now, snake bite, Shotha will be certainly seen, but because of the severity and the poisoning, uh, snake poison can cause a lot of other signs and symptoms also. Shotha is one of them, can be one of them. Trauma by horns, teeth, or nails of animals. When we see such cases, that horns of the animals or teeth, bites, nails, scratching nails of the animals, like you have dogs or cats, especially. So, the scratching of them or the nails can create Shotha. Now, of course, the intensity of Shotha will vary according to the intensity of the causative factor in term, when it comes to abhighataj. Abhighataj is external trauma. Abhighata, ghata to the uh, from the external source. Okay, ghata means trauma. So external trauma, depending on the severity and the intensity, the shotha will vary. So it will be mild shotha or severe intense shotha. So pain and burning and redness and bleeding, etc., will be depending on the intensity of the external trauma. So external trauma can be of by vehicles, chemicals, insects, snake, reptiles, then from various wild animals or even pet animals. Frostbite. So people who stay in the cold weather, extreme cold weathers, or you happen to travel to a very cold place, the blood supply to the periphery of the body will reduce because of the cold weather. There will be constriction, and as the blood supply is reduced, the blood supply back, uh, the drain back of the blood also reduces, and uh, it will cause swelling, numbness, etc. So, in extreme cold weather, also Shotha will be seen. Of course, as I said, the intensity of the Shotha. So here, what we are seeing is the sign of Shotha. Treatment wise, it will depend on the intensity of the Shotha and the causative factor, how soon the Shotha will reduce. So there will be like frostbite, for example. As the temperature comes back to normal, the Shotha also will reduce. If the damage has not gone to a further extent, the Shotha will reduce. Insect bite, suppose mosquito bite. After a while, it will subside on its own. You don't really have to get into the treatment as such, but according to the type of causative factor or the concern, the time taken for uh, the recovery will vary. Okay, so Shotha is observed as a secondary sign in Chardi. Okay, Chardi we have seen. So when I say that it is seen as a secondary sign, so Shotha will be to a body part or to the whole body. So Chardi is there, or Pandu is there, Kasa is there, Shwasa is there, Atisar is there. So you will see when you study the individual diseases, you will find Shotha mentioned somewhere or the other uh, in the signs and symptoms in Rupa or Purva Rupa. Okay, Chardi, Pandu, Kasa, Shwasa, Atisara, Dhatukshaya, Rajekshma. Rajekshma is one of the diseases which we are going to study next. I mean not today, sometime later. Rajekshma, there will be Shotha, Jwara can be related to fever. Also shows Shotha is one of the secondary signs. Udara is swelling to the abdomen. Okay, can be correlated to ascites. Okay, accumulation of fluid in the abdominal cavity. Uh, so here again, as we were discussing, when there is Shotha, there is certainly uh, an assumption that something is getting accumulated inside. Okay, so it can be fluid or liquid in the case of Udara. Udara. In ascites, you know that there is accumulation of fluid. Okay, we will be studying Udara next. Then Arsha. Arsha is piles or hemorrhoids, which we have already studied. So Shotha to the anal region, okay, and to the Arsha is seen as a secondary sign in Arsha. Okay, so as you study these diseases individually, you will find the mention of Shotha to some or the other body part. So Shotha, what is the Samprapti? Pathogenesis, how does it happen? Hetu 7. Hetu is some or the other causative factor. So exposure to that particular causative factor will happen as the first step. Then Vata Prakopa will happen. That Prakupit Vata, Vata Prakopa will be one. Then Kapha Prakopa, Pitta and Rakta Prakopa. So that Prakupit dosha will uh, further vitiate and the Kapha, Pitta and Rakta. Of course, here, as we saw in the causative factors, individual Kapha, Pitta, and Rakta vitiation causative factors also happen. So, when we say pathogenesis or Samprapti formation of this disease, unless and until all these factors come together, the disease will not get formed. So, when you study as a student, initially you will feel how will Vata Prakop also happen, Kapha Prakop also happen, Pitta Prakop also happen, Rakta Prakop or Rakta Visheshan also happen together simultaneously. So, because it has happened simultaneously, hence the disease formation has happened. So, keep this in mind. If suppose three factors are involved in, now I'm talking generic apart from Shotha. When there are three factors involved in the formation of a particular disease, unless and until all the three factors to that particular required strength or intensity do not get vitiated, the disease formation will not happen. What will happen if only one particular element or one particular entity gets vitiated, rest two doesn't? That particular disease will not happen. There would be some other disease with some other signs and symptoms which will happen. Okay, so if suppose Vata, Pitta and Kapha, all three are required in formation of a particular disease, forget Shotha now. Unless and until to that intensity or that level of Vata and Pitta and Kapha Prakopa or Visheshan doesn't happen, that particular disease will not get formed. Till then, If all three get, suppose Vata and Pitta and Kapha, all three get vitiated, but they do not get vitiated to that extent where the disease formation should happen. It will only keep showing some mild signs and symptoms. Okay, so that will be, those signs and symptoms can be considered as what? Milder version? This is a question. Somebody can answer. Anybody can answer. The doshas or the elements which are meant to vitiate to an extent where the disease formation should happen have not gone to that extent but are less vitiated and are showing milder signs and symptoms should be considered as what part in the disease or disease formation? Purva Rupa. Purva Rupa. Okay, I've said this in the past as well. If we are able to catch a particular disease in its Purva Rupa stage, where the elements which are involved in the process of disease formation have not got vitiated to that particular extent, will show milder signs and symptoms which are called as Purva Rupa. And if we are able to diagnose and catch those Purva Rupa in the milder stage, it is easy to treat that particular disease. We have seen Sadhya Sadhyatva. Okay, what is Sadhya Sadhyatva? Prognosis. A particular disease is easily treatable, easily curable. A particular disease is settles while the medicines are on. A particular disease, when comes with complications, becomes difficult to treat or becomes incurable with medicines. How does that happen? Because the extent of vitiation of doshas, uh, the time taken for the curing of the disease will increase. Okay, so as the doshas get vitiated more and more and stay in the body for a longer time, the disease becomes more difficult to treat or becomes incurable with medicines. Okay, so when there is milder form, or when the elements involved in the pathogenesis or formation of disease do not get vitiated or are vitiated in less amounts, in less quantities, they will start showing only the Purva Rupa.
Question, please.
Yeah.
Can you hear me?
Yes, I can.
As most of people, they come when it's already to the disease stage.
Yes. Yes.
Have you seen often people that come in the Purvarupa stage? That's the question.
Yes. See, a patient is coming to you with, now this is not related to Shota because it is a generic question. Let me give you some other example. A patient comes with nausea. Okay, nausea is rullasa. So we know that there is something in the body which is aggravated and wants to come out. Okay, hence nausea will happen. So body has a tendency to throw out whatever is in excess and it doesn't want. So the patient comes with nausea. Then you give some, or suppose, assume that a patient has regular nausea. Okay, keeps feeling nauseatic but ignores it. Usually, many of the patients would. and has vomiting at times, will have burning sensation in the chest, etc. Not too frequently, but whenever has, will neglect it. So this will happen for suppose 15 days or 3 weeks. Now nausea has happened, vomiting, and some burning sensation in the chest, sour burps, etc. has happened, but to a lesser extent. If the patient is properly uh, conscious or health conscious, you can say, and is alert that okay, this is not normal to my body. This, if goes to the next stage, or if it keeps happening on a regular basis, can cause create major problems for me. So what has happened, the patient has one type of patient who has the similar symptoms will come to you in nausea, vomiting, and early stages, and you treat them according to nausea, vomiting, or whatever signs and symptoms are seen. And the other patient who has similar signs and symptoms but does not come to you and keeps uh, experiencing the same things. Okay, the first patient has come in the Purva Rupa stage of what next disease, if you can guess?
Shadi?
Doreen,
Shadi?
suppose I, which one, sorry?
Shadi?
Chardi, or it can be Amla Pitta also. Correct? It can be Chardi or Amla Pitta. Both are correct answers. So the actual stage or formation of the disease, or the full signs and symptoms, the disease gets created when the doshas will aggravate to that particular extent. And if you get patients, to answer your query, who are alert and understand that there is something wrong happening in my body, I need to correct this with medicinal intervention or with medical treatment, will come to you in Purva Roop stage. Okay? And people who seem or who assume that they are very busy with work, and things keep happening because of certain changes in food, lifestyle, etc., and they neglect it, will end up in the proper formation of the disease. So it can be Chardi or Amla Pitta or any other disease. So when Purva Rupa stage happens, and if the patient is alert and aware, will come to you, and it will make your job easy. Or in other case, if the patient has just neglected things and has taken some home remedy on his own or on her own, as per their understanding, will end up in the proper disease and will come to you, which will take some additional time to cure. Okay, so one sentence answer for you is, if the patient is properly aware about his or her body status and constitution, that this is not really, they would know their prakriti. Okay, but I know that my body type is such that if I eat something, I will have problems. If I do this, I'll have problems. If they are aware about their health properly, they will come to you in Purva Roop stage. And trust me, if patient uh, gets connected to you, and you give information and knowledge to the patients about their body constitution, about doshas, about changes as per the daytime or the daily routine, or the rutucharya, the seasonal variation, people will certainly become more aware and they will start coming to you in the Purva Roop stage, because they have developed faith and trust in you and the science. Whatever happens, whatever good you do to the patient is no doubt your knowledge and your skill. Okay, you will always consider that it has happened because I could do proper diagnosis, I could give proper medicines, I could do a proper treatment, hence the patient got well. Ultimately, what has happened, who has done, or what is the entity which has done good to the patient? It is the science. So, as a practitioner, always keep in mind that whatever happens good to the patient is because of the science. I usually, so this is my way of doing it. I don't say that you do it. I always consider that the science has done good to the patient. If there is something which has not happened good, or to the expectation, the results have not come, then it is lack of my skill and my knowledge and my understanding. The science is a complete science. Okay, so hence Sadhya Sadhyatva also. I think Doreen also had asked this question before about Ayurveda has answer to everything. It can treat all the diseases which we see, etc. How can we call a particular disease as asadhya or cannot be cured? So here there will be limitation of approach of that particular treating doctor, or his skill or his understanding of that particular disease, and the experience which he has with a particular disease. So few diseases may not be uh, treated with medicines only, may require surgical intervention. Okay, so in that case, it will become asadhya with medicinal approach. Okay, so again, I'm going away from the main query. Uh, People will come to you in the Purva Rupa stage when they are more aware and conscious about their health status. Okay, so I hope this answers your query, Doreen.
Thank you.
So, yeah. So, again, coming back to the example of all the entities in the disease formation, unless they reach to that particular extent of vitiation, you will not see full blown or fully formed disease. Till then, it will keep showing the Purva Rupa stage. And let me also tell you, if a particular patient is or the person is aware and conscious about his health status or her health status, and sees something which is uh, wrong in their body, and knows, okay, what should be done in this case. Suppose I feel heaviness in the body because I had heavy food, the previous meal was very heavy. I have consciousness, I have understanding, I'm aware that if I do fasting, or I eat less food, or I give more time for that food to digest, then whatever problems can occur in future will subside immediately because of some change in my routine or my lifestyle or my food. Okay, so people, because you give information to the patient, or people are aware about their health concerns from other sources, if they do certain changes in their lifestyle or in their food, or they do some remedy, home remedy, can settle the dosha in the Purva Roop, in fact, before the Purva Roop stage also. Okay, so people who are more aware will settle their doshas or the vitiated entities in the initial stages itself. Few people will take some time, will neglect or may not understand the changes, will come to you in Purva Roop stage. People who are completely neglectant and want to just buy time because health is not their priority, something else like their profession or money earning or business or whatever is their priority, will come to you only when the disease has got fully formed or has become more complicated with the other upadravas or complications. Okay, so coming back to Shotha, Hetu 7 will happen. Vata Prakopa will happen because of various factors, Kapha, Pitta, and Ratta Visheshan, according as per their causative factors will happen. This Visheshan will create obstruction in Bahya Sira, arteries and veins. Bahya Sira is external arteries or veins. Sira is either artery or vein. Creates obstruction in Bahya Sira. Obstruction Vata movement. Obviously, when there is obstruction in any part of the body, wherever there is movement, uh, that will cause obstruction in the movement of Vata. So, obstruction in the Bahya Sira through which fluid will keep moving. So, it can be blood, it can be uh, interstitial fluid or whatever is moving through that Sira. Obstruction to the Vata movement will happen. Accumulated doshas move out of the Sira. So the doshas which are inside the Sira, now consider suppose you have a artery or a vein, and out of because of the obstruction, now for example, you have this Sira, and here there is movement of blood happening inside, but there is obstruction because of visheshan of dosha. There is obstruction to the terminal arteriole or venules, and because of that, there is whatever accumulation of doshas are inside, they will come out uh, of the sira, and then they will get accumulated in the interstitial fluid, interstitial space. Interstitial space is space which is outside the vessels or the sira, that is called as interstitial space. There, that those doshas will get accumulated and will create sthana samshraya in skin and mamsa. So when it comes out of the arteriole or the venule, it will get accumulated in the mamsa and the skin. Okay, so that is the interstitial space, and it will cause create the disease called as Shotha. So starting from Hetu 7, Vata Prakopa will happen, Visheshan of Kapha, Pitta, Rakta will happen. It will create obstruction in the arteriole or venule or the sira. Because of the obstruction, movement of Vata will get obstructed, and then Vata will try to move in the lateral way. Okay, and because of that lateral movement, whatever doshas are accumulated inside will come out. No dosha has the uh, power of movement by its own. Okay, Kapha and Pitta do not move by their own. Vata will give them gati or the speed. Okay, movement. So, Vata, because of obstruction, it will start moving laterally, and accumulated doshas will come out of the sira or the arteries or veins, and will get accumulated underneath the skin and uh, between the skin and the mamsa, the muscle tissue, and will create shotha. So this is the samprapti or pathogenesis of Shotha disease.
Yes.
Just to make sure that I understood, it means it's breaking the veins walls, isn't it?
It will not break every time unless there is external trauma. Okay, when there is external trauma, then it will break, and then the interstitial fluid or the contents inside the artery or vein will come out. When it is agantuj, vataj, pittaj, kaphaj, vata, pitta, kaphaj, and so on, the first seven types, which are nija, in that case, only uh, uh, the arteriole or the venule will swell, and as it swells, the gap between uh, the lining of the arteriole or venule will increase, and the contents of uh, the sira will come out. So, in Nija type of Shotha, you will very rarely see breakage of the sira of the arteriole or venule. When there is agantuj or abhighataj trauma, external trauma, then there will be breakage of arteriole or venule. Okay. Till then, when it is nija, it will only swell and expand in its size, and the contents will come out of the sira or arteriole or venule. Okay.
Thank you. Eric.
So, what is the Purva Rupa or premonitory signs and symptoms which are seen in Shotha? Body temperature. So, when I say body temperature increases, that part of uh, where Shotha is about to happen, temperature in that particular area will increase. Feeling of burning sensation can be seen. Mild pain due to stretching of the sira. Now, here is the answer to your query. That mild pain due to stretching. So when there is obstruction and the stretching of the sira, it can be artery or vein, there will be mild pain, and the contents will start oozing out. Oozing is the word, correct? Oozing out. Heaviness in that region or in that body part can be seen as a purva roop. Okay, so in that case, if now patients uh, see that, suppose uh, when there is how do we say now, in Nija Shotha, not many patients will understand that this Shotha is happening as a disease. But when there is abhighataj, okay, when there is external trauma, um, patients will do home remedies. They will do ice pack, or they will do hot fermentation, or as per their understanding, and try to heal that particular shotha. So initially it will be mild swelling, but if with the patient's hot fermentation or ice packs, if it does not subside, it can go to the next stage of further swelling. So a small localized swelling can become larger in size with improper understanding of the treatment. So in Rupa stage, according to the doshas, Vataja Shotha, pain is the dominant feature. Now, I have said this multiple times that if you have fair understanding of the doshas, the properties, gunas of the doshas, you can certainly relate what can be the presenting sign symptom uh, in that particular of that particular type of disease. So, if you have fair understanding, if there is intense pain, you understand that it is vataj. If there is burning sensation, okay, so pitta also is involved. When there is itching, kapha is also involved, etc. So as you study more, this understanding will develop faster, and your uh, diagnosis or your time take the time which you take for diagnosis will reduce drastically. Pain is the dominant feature in Vataja type of Shotha. It usually affects the joints. The swelling will be movable with thin skin over it, rough and coarse in nature. The touch is rough and coarse. Has blackish color. Okay, so Vataja type of Shotha. These are the features. Pain is dominant. Usually joints get affected. Swelling will be movable. Okay, so it's not that it will keep moving from one place to the other, but it will keep varying also. So if suppose this joint has got affected, okay, so you will see the swelling, suppose in on the left side, then you slowly gradually it may just shift to the middle and go to the left side also. So movement, do not relate movement only to from one place to the other. I relate it to the intensity of swelling also. So it will reduce fast, it will increase fast. It is again a feature of Vata dosha. It will reduce fast and can increase fast as well. Numbness will be present as one of the symptoms. Harsha or horripilation, because of presence of Vata, you can see horripilation. Horripilation is goosebumps. On pressing and releasing, it quickly rises to the surface. Now this is called as pitting edema. You must have heard this before, that there is swelling. You press to check how it is. You press and it creates a pit. It goes down. Okay, and when it is Vataja type of Shota, it will very spontaneously come up. I mean, not immediately though, slowly, but it will come up faster compared to the Kaphaja type of pitting edema. On pressing and releasing, it will quickly rise to the surface. The pain will be predominant during the Vata times of the day. Now, let us not discuss when is Vata more, when is Pitta more, when is Kapha more. We have discussed this before and you have studied it before as well. So just keep in mind, when the pain is more during Vata times of the day, it is Vataja type of Shotha. The Shotha increases in the daytime and decreases usually in the night time. Okay, why it is more in the daytime? Because there is movement. Whenever there is movement, Vata will be involved in that movement. Hence, the Shotha will be more, and on resting, it will reduce. Okay, on resting, it will reduce. That is Vataja type of Shotha, and opposite will happen in Kaphaja type of Shotha. It will decrease during the daytime and it will increase on resting. Okay, or in the night time, or not resting in the night time usually. Fair. So this is Vataja type of Shotha. Pittaja type of Shotha. The swelling will be smooth and soft, emits some odor, has blackish or yellowish discoloration. The swelling will be smooth and soft, emits odor, some odor, so some smell. Okay, usually when a larger body part is involved, or when there is swelling in the whole body, the odor from that particular region or the body part will be there. But here, the patient will realize it more than you do. Okay, because you will only see it once or twice before you start the the actual treatment. But the patient will, if is more aware, oh, I can, oh, there is some different smell to this, because the patient is in contact with that body part more than you are. Has blackish or yellowish discoloration. Okay, One more thing is when there is Pittaja type of Shotha, Kotha will happen faster. Kotha is decaying. Okay, decaying can happen faster. So when the decaying process has started in the initial stage itself, the odor will be seen. So when there is decaying, naturally what will be seen? Pus formation inside. Pus formation will be seen. So that pus will emit its odor, which the patient usually will be able to understand better. Associated with jwara, fever, if the body part is, if suppose, so when we say fever, if major body part is involved in the shotha, then fever, temperature change or rise in the whole body will be experienced. If it is localized, then increased temperature only in that region will be seen. Okay, so relate jwara or fever to only that body part when it is localized. Brahma. Brahma is a giddiness. Sweda. Sweda, we know, sweating, tendency to sweat. Trushna. Trushna is thirst. Okay, so the patient will feel more thirsty. Daha, burning sensation. Sparsha, asahatva, and paka. Sparsha, asahatva is sparsha means touch. Asahatva is not able to bear. So, not able to bear the touch. What is it called? It is called as tenderness. Okay, it is called as tenderness. And paka. Paka is kotha or suppuration. We saw that. I just spoke about it. So when there is presence of pitta, decaying or pus formation can happen faster than vataja and kaphaja. Pain will be more during pitta times of the day. Okay, so that will be pittaja type of shotha. Kaphaja type of shotha, the swelling will be hard and heavy, pale in color. Okay, uh, associated with aruchi, nidra, nausea, vomiting, mandagni. Now here, when there is uh, involvement of major body parts or more uh, body, I mean more body in the sense major part of the body has got swollen, then we can see associated symptoms which will be seen on the whole body. Okay, what is it? The aruchi. So here the vitiation of dosha, the extent of vitiation of dosha is more, so that we see um, symptoms which are affecting the other symptoms as well, other systems as well. Okay, so aruchi, nidra is sleep. So feeling of sleepy feeling. Nausea or vomiting can be seen. Mandagni, reduced agni, can be seen as the other associated signs and symptoms. Pit created after applying pressure does not rise quickly. So this is typical kaphaja type of shotha. The pit which gets created after applying pressure, you press with the finger, and it will take some time for you it to rise back to the level which it was. So when we do sparsha pariksha is important here. Many people do not do sparsha pariksha, so which may be due to lack of time or negligence or not giving that much importance to touch. I have seen doctors who do not touch the patient at all and just ask questions, see and prescribe medicines. So Ayurveda believes in Triveda, Ashtavida, Dashavida type of pariksha. We have studied that in the past. So in Triveda pariksha, basic is darshana, sparshana, prashnayi. Okay, what we see through your eyes is darshana, sparshana is the touch. So in touch, various things you can understand. the temperature of the body. You can feel the touch. So touch is the nature of the body part. So it can be hard, it can be soft, it can be coarse, it can be smooth, it can be cold, it can be hot. The edema, you press and you can see the edema. It will come. So it can rise quickly, it will not rise quickly, etc. So that will, you will only understand if you touch the patient. Okay, how hard it is. Amavata, we have studied that. So unless you touch that body part or the painful joint, you won't understand that the temperature of that particular joint has increased. Okay, so your diagnosis, differential diagnosis between Sandhivata and Amavata is such, wherein the temperature of that particular joint increases in Amavata and is normal in Sandhivata. Normal means is same as the other body part. So unless you touch the patient, you won't realize that. So every time when you see the patient, even during the follow-up, darshana, sparsha, prashne, every time see, touch, and ask questions. Okay, that is very important for you to know small things. See, when you ask patients, okay, tell me what you are experiencing during your consultation. Patient will just tell you what he or she experiences on priority or at large. What is my bothering concern? Okay, 5 things I tell you. But in order to understand the vitiation or involvement of doshas better, if you ask leading questions, so do you feel it the whole day? No, no, I feel it more in the night, more in the morning. I feel it more after my food or before the food. So that will give you a hint of what dosha is involved and what is the type of that particular, suppose uh, a particular disease you are going to. In that also, what is the subtype, whether it is Vataj or Pittaj or Kapaj. Okay, so when we say a particular now this particular Shotha is three doshaj and Rakta Visheshan also. But still we are learning Kafaja type of Shotha, Vataja type of Shotha, Pittaja type of Shotha. Does that mean the other doshas are not involved? They are involved. But which is the predominant one? Okay, if you see Kapha type of signs and symptoms, then it is Kafaja type of Shotha and then you treat accordingly. Okay, so when you ask leading questions to the patient, then only you will know what is the deeper uh, level of involvement of dosha. Okay, so it all started from pit created after applying pressure does not rise quickly. So uh, sparsha pariksha. Okay, that pitting edema will take time to rise back. Increases in the night time. The Shotha will increase in the night time when there is Kapha one, and second when there is less movement. Okay, that is Kaphaja type of Shotha. Then Dvandvaja and Sannipataja Shotha are also the 4 types. Dvandvaja will be 3 and Sannipataja is 1, wherein all the 3 doshas will increase in the same extent or to the same extent. So mixed signs and symptoms of the involved doshas are seen here. Okay, so you will see few signs and symptoms of Pitta Vataj or Kapha Vataj, or according to the signs and symptoms which you see, you can understand which is the one which needs the treatment. Okay, again keep in mind the labeling of uh, the disease is not important. Labeling of the disease, this is this type of uh, disease or this is the subtype. You should be clear in your understanding of what the problem is and what is the line of treatment. Charak Acharya Charak in Charak Samhita says that naming a disease is not important, because as the science evolves, as we move ahead, as the age of the earth also goes ahead, there may be something new which may come up. So in that case, we may not find the uh, a particular disease wherein all the signs and symptoms are mentioned. So a new disease has come up. So what is the treatment in Ayurveda? Suppose, for example, COVID. Okay, so in COVID, as COVID, it is not mentioned in the classical textbooks. What will we do? So if a patient with COVID comes, you say, okay, no, it is not mentioned in our textbook, we will not treat you. Go. No, we understand what is the problem which the patient is facing. What is the dosha involvement? What can be done to correct the dosha? Simple as that. So naming a particular disease, even if you are not able to uh, label the disease properly, or you're not able to recall, okay, what was it called, I'm not able to recall what is the name of the disease, doesn't matter. What is the problem which the patient is facing? What can be done to alleviate that problem is important. So in your case paper, okay, this is amla pitta, this is vataja shotha, or this is pittaja arsha. May not be uh, as important as the treatment. Okay, but yes, your understanding of the doshas, of the problems related to that particular dosha is important. Okay, so when new diseases come up, you have to understand what is the concern, what can be the dosha involvement, and what can be done to treat it. Okay, so Dandoja Sannipataja type of Shota mixed signs and symptoms involved will be seen, and accordingly the line of treatment should be planned. Abhi Agantuja type of Shota. So in this, both the type of Shotas are involved. One is Abhighataj and second is the Vishaja. So Shota spreads fast. Now because there is external factor, the vitiation will happen very fast, and the formation of the disease will happen faster. Shota spreads faster, extremely painful depending on what is the extent of and the intensity of the causative factor. Burning sensation can be more. Ushna sparsha will be there. Redness can be there. Now here, when there is external trauma, redness, damage to the artery or the vein will happen, and the redness can be more because internal bleeding has happened. So in that case, redness will predominantly be seen when there is abhighataj type of shota. Okay, when there is external trauma, majorly redness will be seen as one of the presenting sign. Tenderness, yes, because of the intensity of the trauma. As per the intensity of the trauma, tenderness will be less or severely more. So suppose there is fracture, the bone has got fractured, so two bones here, they got fractured, and this is now into two pieces, this part is into two pieces and it is bent here. Okay, so this bent is not natural, it is due to the external trauma. Now because there is external trauma and there is breakage in the sira, arteriole, venules, and the bones, whatever was present inside the marrows will be or in the lumen now will start coming out, and there will be severe swelling, intense pain. People who have experienced a fracture can relate to these words. There is intense pain. Swelling happens extremely fast because of why the swelling will happen faster. because there is damage to the capillaries or arterioles, venules. So in Ayurveda, we'll call all of them as siras. So there will be damage to the sira, and because of the pumping of the heart, the movement of these fluids keep happening very fast, okay, and on a regular basis. So when there is breakage to that, it will start oozing out. It will start coming out of that lumen, and the swelling will happen very fast. Okay, so in Abhighataj type of Shotha, this Shotha will happen faster. The swelling will happen faster. It is painful, depending again on the intensity. Burning sensation, temperature of that body part will increase. Redness will be majorly seen, and tenderness. They will not allow the body part to be touched. So when there is fracture or when there is severe damage, the patient does not allow you to touch because the pain is so intense. Okay, so that is Agantuja type of Shotha. Prognosis, early stage and without complications. Shotha in Shotha is easy to treat. Okay, in early stages, the Shotha will be easy to treat. Old Shotha or chronic Shotha with complications become difficult to treat and becomes asadhya as per complications involved. Okay, so in Nija type of Shotha, it will become chronic. Chronic means more in age, more number of days the disease has stayed in the body. That is called as chronic disease. So in Nija type of Shotas, which is the doshas, Vata Pitta 3 and then Dvandvas 3 and Sannipatas, it will become chronic and then it will have complications. And then it can become difficult to treat. Even in terms of the Abhighataj, so or even Vishaja, so Agantuj, it can become asadhya depending with medicine, of course, with medicine, depending on what is the level of what is the causative factor and what is the severity of the damage. Okay, so medicinal. When we are saying here, it can become asadhya. It is the involvement of medicine. As per the medicine involvement, it can become curable or incurable. Okay, so that is prognosis of the Shotha. Upadrava, what kind of complications can be seen in Shotha? Chardi, Shwasa, Aruchi, Trushna, Jwara, Atisara. You know the meaning of all these words. Chardi is vomiting, Shwasa is breathlessness, or asthma when it is a fully formed disease. Okay, Shwasa as a symptom is breathlessness, and when it is a fully formed disease can be labeled as asthma. Okay, then aruchi, we know this, impaired perception of taste. uh, then trushna, thirst. Jwara, fever. Atisara, diarrhea. Now again I am saying I do not really like chardi to be called as vomiting, or shwasa as asthma, or pandu as anemia. It's not me as a person, but in the overall understanding. So when we say, suppose pandu is anemia, may not essentially be anemia all the time. Okay, because pandu has other signs and symptoms also, which anemia is otherwise, only anemia, if you study from modern perspective, will not show as signs and symptoms. Okay, so just for our understanding and for correlation, we call it, okay, chardi is vomiting, etc. Atisara can be correlated to diarrhea. Weakness, daurbalya, can be one of the complications. So this will and reduced urine output majorly in Kaphaja type of Shotha. Kaphaja type of Shotha, reduced urine output can be seen. Now, in Pitta and Vata also this urine output reduction is seen, but more in Kaphaja type. Now, why will this happen? Because it is if it there is a bigger or larger body part which is under the under the influence of Shotha, or larger body part is involved in Shotha, then the fluids in uh, in the in the lumen, in the sira, have oozed out and have come out. Hence, the urine output is less, and as the swelling keeps on increasing, the urine output further will keep reducing. Okay, so we have to ensure when we talk of the treatment also, we will discuss about it, that uh, mutra virechaniya mutra virechaniya dravyas should be given. Mutra virechaniya means the dravyas or the herbs which will uh, stimulate the formation of urine. Okay, so many times you will see in the modern approach, in the modern medicinal approach or the Western medicinal approach, that you see edema and not laxatives, um, medicines which will increase the urine output are given, so that whatever is in the interstitial space because of osmosis will come inside the lumen. Okay, because the pressure uh, inside the lumen of the sira has reduced because of more urine, then whatever is outside the interstitial in the interstitial space and outside the sira will start coming inside because of the osmosis. Okay, so it will travel from higher pressure to lower pressure space, that is called as osmosis. Shotha. Now, chikitsa. The treatment of Shotha is antagonistic to the causes and causative dosha. Any treatment, for that matter, is opposite to what the causative factors are, what is the dosha which has got vitiated. Okay, because we have to elevate the dosha, pacify the dosha, or we have to eliminate the dosha. How do we eliminate? By Shodhana process, Panchakarma. When the Shotha is in Ama stage, now Ama stage is the early stage, okay, and then it can become Nirama stage also. So in Ama stage or with Ama also, then Langhana and Pachana are given. Okay, so when there is usually Kapha involvement, then Ama can be seen in that stage. Now, Aruchi is there, indigestion is there, Mandagni is there. Obviously, Ama will be formed. So, in that case, Langana and Pachana are given first and then the rest of the treatment. Okay. When the Shotha is matured or Nirama stage, then it should be subjected to Shodhana. So, in the line of treatment, every time we keep in mind when there is Amaja presence of Ama, we do not do Shodhana. We have to do Langana and Pachana first, and after the Ama is digested, only then we do Shodhana. So, subjected to Shodhana, Vamana and Virechana. Vamana and Virechana will be given only when there is major body part which is involved and doshas have vitiated to that extent and need to be eliminated. Only in that case we do Vamana and Virechana as per the dosha involvement. So what is the specific treatment in Vatajashotha? Trivritta Churna Eranda Taila in presence of constipation. So when there is constipation and Shotha, then Trivritta Churna Eranda Taila should be given as laxatives. Shali, Kshira, Mamsarasa in diet, rice cooked with milk and meat. So Shali is the red rice, okay, and Kshira is milk. Mamsarasa in diet. So Mamsarasa is soup, meat soup in the diet, which will give nourishment to the dhatus and it will alleviate vata dosha. Rice cooked with milk and meat can be given for nourishment. Now here we have to understand what is the uh, Agni Bala, strength of the digestive fire. Accordingly, these things should be administered to the patient. It should not happen that the Agni of the patient is low and you start giving these things which are heavy to digest. Shali, Kshira, Mamsarasa, uh, rice cooked with milk and meat are heavy to digest. So, even if we are planning to or our intention is to elevate vata dosha, we have to make sure that the dosha, the Agni Bala, strength of the Agni is good in order to digest these things. So, what should be done is you should give these things in lesser quantities first and see that the patient is able to digest it and then slowly increase it in quantity. Swedana, fermentation with vata elevating medicine. Then mild mardana. Now massage with vata oils, vata elevating oils. When we say mardana, it is really mild massage. It's really mild massage. Don't just go by the word mardana because mardana actually means applying pressure. So mild massage or very gentle massage is expected here. Okay, so what we are doing is we are trying to stimulate the movement of the interstitial fluid and remove the blockage. Parisheka, Dashamula Kvata. Okay, Parisheka, we know what is Parisheka now, and Parisheka with decoction of Dashamula herbs should be done. It will alleviate the Vataja type of Shotha. Lepa. Lepa also we know now what is Lepa. Shunthi, Erandamula, Nirgundi, Musta. These are the herbs which can be used for Lepa. If they are fresh, can be used fresh. Powder form can also be used. Now here, if you do Pradeha, in Lepa, if you do Pradeha, it will help better. What is Pradeha?
Hot
What is?
leper? Hot leper?
Yes. Who is answering this? Doreen.
Nicole.
Nicole. Who is answering this?
Nicole.
Nicole. Okay, good. So a hot lepa is Pradeha. Very good. So when there is involvement of Vata and Kapha, hot lepa or Pradeha will help better. When it is Pitta involvement, then what should we do, Nicole?
Cold leper, but I can't remember how to say it.
The cold
Pretty
lepa. Okay. It's okay. Even if you say cold lepa, that is fine. Okay. So Pralepa. So it's not really cold, but it is room temperature. The herbs which we use, the ingredients which we use have cold potency. Is what is Pralepa. So Shunthi, Erandamula, Nirgundi, Musta can be applied. Pradeha will help better. Niruha Basti. Okay, Basti with decoction of Dashamula when there is higher involvement of dosha. Niruha Basti can be administered when there is constipation. Niruha Basti, Anuvasan Basti, both will help. It will give Anulomana Gati or the natural direction, a movement to the Vata dosha. Okay, so Niruha Basti with Dashamula Vata, Anuvasan Basti with Bala oil can certainly help in Vataja type of Shotha. So this is overall Vataja type of Shotha line of treatment. Not all will be required in all types of Vataja Shotha. You have to decide based on what is the vitiation. What is the extent of vitiation of dosha? Accordingly, the other things, basti, anuvasana, etc., should be administered. Okay. Pittaja type of Shodha. Virechana should be administered with Aragvad, Haritaki, Amalaki, Nishottar. So, Virechana should be given Sneha Purvak. Virechan, Sneha Purvak means after Snehana, Virechana should be given. Tikta Ghritas for Shamana. Shamana is pacification. So, for alleviating Pitta dosha, Tikta Ghruta. Ghruta, which is uh, medicated with Tikta Rasa herbs, should be administered. Arogya Vardhini, Sut Shekhar Rasa, Chandrakala Rasa, these are ready preparations which are available there, can be administered in Pittaja type of Shotha. Lepa, turmeric, red sandalwood. So, the turmeric which is mentioned here, there are three types of turmeric which are available here. We have Haridra, we have Dari Haridra, and we have Amra Haridra. So these are three variants, out of which Haridra, the regular turmeric which you have, is available there. Red sandalwood, Rakta Chandan, sandalwood, Chandana, Haritaki, we know Ushira, aloe vera can help in Pittaja type of Shotha. Parisheka, cold or room temperature milk. Interesting. It will alleviate Pittaja type of Shotha. Okay. If depending on what is the temperature of the area where the Shotha is and the temperature of the weather there. Based on that, you can decide whether it should be room temperature milk or cold milk, which should be used for Parisheka. So when there is more heat, cold milk will help better. Okay. So when there is more burning sensation, when there is more redness, so that time uh, cold milk will help better. Okay. So that the burning sensation and the burning pain also is one entity which you should know. Burning pain. So the burning is so intense that there is feeling of pain. So that is burning pain. It will alleviate with parishek of cold milk. Kafaja Shota. So burning as it reduces, then you can stop the cold milk parisheka and then you can shift to room temperature milk parisheka also. Kafaja Shotha. Vamana with Madan Phala. This is one of the herbs which should be used for Vamana. Mutral herbs which stimulate the formation of urine. So Punarnava, Shunthi, Haritaki, Shilajit, these are the herbs which will stimulate the formation of urine. Punarnava Kwat. So this decoction I think is available there. Punarnava Kwat or Kadha, that is called. Varunadi Kwat is I think available there. That can be administered in Kafaja type of Shotha. In fact, Varunadi and Punarnava you can give in the other type of Shothas also. Okay, because as we know that this is three doshaja, involvement of all the doshas are there. So Varunadi and Punarnava can help in elevating the other types of doshas also, other type of Shothas also. Good Ardraka Yoga. Now this is a bit different. Hilary, I'll take 5 more minutes. I know that it is time for a break. Just give me 5 more minutes.
Yes.
Yeah, so Gudardrak Yog is Guda is Jaggery, Ardrak is Shunti. So more than Shunti, it is ginger. Okay, fresh ginger. So both in equal amounts should be consumed 25 gram. Now this is a bit different. Okay, and because it is available there, both these items, jaggery as well as ardrak ginger, or even ginger powder for that matter, can be used based on the type of dosha which is involved. So when it is kaphaja, you should use fresh ginger. When it is pittaja, still you can use good ardrak, but ginger powder should be used and in less quantity. Now here, because it is kaphaja type, we have said that uh, 25 gram or fresh ginger can be used. Now 25 grams is what we usually start here. Okay, based on the weather, based on the type of constitution of the patient, based on the type of or extent of kapha dosha involvement, you can decide what should be the quantity of this Guda and Ardra combination. Okay, so 25 grams, you can start with 5 gram also, then increase it to 10 gram, then increase it to 15 gram. See how it is working, and based on that you can decide how much quantity should be given. We give up to almost 100 grams as well, but don't relate it to 100 grams, because that we have developed through experience and through various repetitions in patients. So don't relate it to the number. You can start with 5 gram. So in 5 gram, 2.5 gram, 2.5 gram mixed together. Ask the patient to eat. Okay, once a day, then go to twice a day, then go thrice a day, and then you can increase the quantity. Then again do it once a day. Then for 2 days. After that, increase it to twice a day for 2 days. Again, increase it to three. So based on uh, the the bearing capacity of the patient, you can keep on increasing the quantity. You can go up to 25. I think you can go up to 25 and keep a 25 as your higher limit, and then you can reduce it as the shotha decreases. Okay, so this will take care of not only elevating the kapha dosha, but will also take care of ama, subtle ama, if it is present. Okay, so I suggest start with smaller quantity. Start with 5 gram and then gradually increase it. Okay, I think because it is readily available, this can be one of the mixtures or combinations which you can use in your line of treatment. Good Ardrak Yog. Chandra Prabhavati, Arogyavardhini Vati, these are available there. So these can be used in Kapaja type of Shotha. Goat intestine soup twice a day. So if it is available there, so approximately 6 inches of goat intestine clean soup of that is prepared and is given twice a day, is what we follow. If it is available there, you can do it. If not, it is okay. You can rely on the other type of medicines which are available. Pathya.
Excuse me,
So
Dr. Swapnil.
yes,
I have just a question on the Kapha Shota Shikitsa. Can we include Udvartana as well there? Udvartana treatments?
it can be done. Uh, it can be done. However, we don't usually do it, but it can be done. It can help if the patient is able to bear it, and you can try. Although it is a good thought, I should say, but seldom we use. I have never used it in Shotha patients, because usually it works on cellulite, in on Meda Dhatu, correct? We studied
Mm-hmm.
that in Odvartana. So because this is, it will alleviate kapha also, so you can try with it. However, you should make sure that the pressure which you apply while doing it should be mild. Okay. Now, what happens in Shotha is because there is swelling, the size of that particular body part will increase. Naturally, the skin will get stretched. Okay, and as it gets stretched, it will become thin. Okay, so when it is thin and you apply something which is coarse and hard and rough, and you apply it with pressure, it can damage the skin as well. So you have to be very particular. Hence, I'm saying we haven't used it before. You can try it at your end. Okay, so but
Okay,
be
thank
careful.
you.
Okay,
Okay, thank you.
okay. So, Pathya, milk diet. Okay, so this is something which we usually tell when there is larger involvement or larger body part involved in Shota. Milk diet. Okay, so we tell the patients to reduce on consumption of water than what they usually do, because water will easily seep out, ooze out of the interstitium of the sera, and the shota can increase. Correct. So when we do mutrala dravyas or mutra virechaniya dravyas, which will help in formation or stimulate the formation of urine, we are ensuring that whatever is the excess fluid is going out, and the shotha, the swelling will reduce. So hence milk diet will be good. You can tell the patient to be only on milk for some time, so it will help. Okay. Laghu Ushna Ahara Puranashali. Puranashali, that is old rice. Yava barley. Purana Ghruta, old ghee, goat milk, aja ghee, that is milk, ghee prepared out of goat milk is good. Now here, after understanding the uh, properties of that particular food item, you should decide which one should be given in what type of shota. Okay. So when you have understood what is the involvement of dosha or the predominant dosha, accordingly, in Pathya also, which is the item which you should give more, or which you should allow the patient to eat more. Drumstick, chicken soup, madhu or honey, patola, that is pointed gourd, then garlic, draksha, draksha is raisins, and rest is what is pathyakar. So garlic in pittaja predominant shotha, you may not tell garlic. In vataja and kapaj, you can tell garlic. Okay, so even if it is pathya, in that also according to the subtype which should be given as per the predominant dosha, you should be able to decide that. Okay. Apathya, meat of aquatic animals, salt. Naturally, we tell that the salt should be less. Curd, salt has that tendency to uh, restore water in the body. Correct. So hence, we tell salt to be less for hypertension patients also. Curd, that is dadhi, adhyashan, eating food over the food. Guru, heavy to digest, vidahi, corrosive food items, intercourse, exercise, that is physical activity, should be apathya, or should not be done, should be avoided while there is shotha. Now here, uh, as per your, as per the involvement of the body part, you can decide what is pathya and apathya. If suppose there is only swelling to abhighataj, for example, so there was a trauma to the finger, and there is only swelling to this part of the body. In that case, Vamana Virechana and all those things or Pathya Pathya may not be required. So even if the patient is not following food items or food habits properly, your medicines and the external treatment should help to cure uh, this particular swelling or swelling to only that finger. So depending on what is the extent of swelling, what is uh, the body part which is involved in that, and the visheshan of dosha, you have to decide what should be the line of treatment and what should be the pathya and apathya which should be administered. Okay. So with this, we conclude Shotha. It is past 8 here. Uh, so Hillary can guide how much time should be the break. If you have any questions,